For many people, celebrating the holidays can lead to anxiety and depression. On November 28th, the University of Maryland Medical System and the University of Maryland Baltimore will be hosting a community conversation called Not All Wounds Are Visible. Joining me now are Dr. Adam Rosenblatt and Donna Jacobs. Welcome, both of you.
Thank you.
So talk about this time of the year being sort of triggering for people who are experiencing depression or anxiety. Why is that?
Well, there's a great deal of angst that people go through trying to get ready for the holidays, worrying about their financial situation, worrying about family dynamics. And so often, and also the later days with less sunlight for some people.
Yes.
So many people see that they experience more depression at this time of the year.
It's a lot to sort of juggle everything. I've talked about, I handle seasonal depression this time of year all the time. So waking up in dark and coming home in dark, that's a lot. But then you add on other triggers about the holidays. And I think a lot of times people don't realize that it can be difficult for our coworkers or our friends because we're so joyous, isn't everybody? Yeah. But you're talking about this in a way that makes people less afraid to talk about it. Talk about the actual conversation that's going to be happening soon.
So these, this is part of a series, and it's called Not All Wounds Are Visible, a community conversation. So it really is meant for lay people to come and be able to ask questions and hear information from experts. We have a particular, although not exclusive, focus on men. And we'll talk about depression and anxiety in men, but anyone can benefit from this. We'll also talk about the rate of suicide and suicide prevention, and as well the overlay that chronic disease may have on depression and mental health for people. And there's plenty of time built in for question and answer. We've also found that people really enjoy in this series hearing from others who experience what they may be experiencing and learning about their sense of recovery and resilience and how they've benefited. So we have two things. One is a panel of 4 gentlemen, lay people, a writer, an attorney, someone who works in marketing, someone who does college administration, who will talk about their experiences. And we're very fortunate to have Jamal Lewis, retired Raven, coming up from Atlanta to talk about his experience and what he went through in terms of depression and anxiety once leaving NFL football.
Really an important conversation to be had. And Dr. Rosenblatt, I want to ask you, who does this actually affect? Is it everybody, or is it, you mentioned men, is it mostly men or mostly women or older or younger? Who is affected?
Well, there's more depression in older people. Men and women probably don't have different rates of depression, but depression is more deadly in men and more deadly in older people. Is more deadly in men because they have, unfortunately, a much higher rate of suicide.
Why is that?
Well, nobody really knows, honestly, but I think one reason is that they use more lethal means, things like firearms. It also may be that men, for cultural reasons, are less likely to seek help early in the course of their depression, and so they may not be getting treatment that would help them, to have it not come to that point.
It's sort of that idea of masculinity, and do you get help for depression or anxiety?
Exactly. People think they're supposed to tough it out themselves. That's why I was very grateful when somebody who's a public figure that people look up to is willing to open up about their own struggles, because that might inspire somebody to get the help that they need before it's too late.
Right. And then thinking about the elderly too, I think a lot of times you don't think like, you're happy and you've lived a great life. Why are you depressed? I think a lot of times there's that that judgment where you're breaking down those barriers and starting this conversation, especially around the holidays.
Well, that's part of what we hope to do, to break down barriers, to break down the stigma. Certainly for the older population, they may have grown up in a time where talking about your mental wellness was not in vogue.
Right.
And so they would rather try to tough it out, do it on their own.
So why have the medical community get involved and have this conversation?
Well, we have certainly seen, and I would think any health professional will tell you, that there are many more people now coming in with symptoms of depression and anxiety or mental illness in some other regard, and that it makes it more difficult sometimes to even handle somatic, your physical health challenges. If you can't take care of yourself, your physical health may suffer even more greatly. So it's important to us, sure.
It's all connected. All right, so who can come to this event?
It's open to anyone who might like to come. It is free. It's an entirely free event. It's from 9 to 3. We would like people to register in advance. That will help us. There is lunch that will be provided, so knowing the numbers is important, and if they go to our website at ums.org/communityhealth, they can register.
All right, Dr. Rosenblatt and Donna Jacobs, thank you so much for joining us, and we'll be right back with more Midday Maryland right after the break. Stay tuned.